Clomiphene, Clomiphene, uses, dosage, and side effects. Clomiphene is a medication commonly used to treat infertility in women by stimulating ovulation. It works by triggering the hormones needed to release an egg from the ovary, increasing the chances of pregnancy. This is especially helpful for those with irregular or absent ovulation. Clomiphene is typically taken early in the menstrual cycle under a doctor's guidance. It is available under brand names such as Clomid and Seraphine. What is Clomiphene? Clomiphene, Clomiphene, is a fertility medication used to treat women who do not ovulate, such as those with polycystic ovary syndrome. Twins are more likely to be born as a result of use. It is taken orally once a day for 5 days as part of a 5-day course of treatment. What are the benefits and uses of Clomiphene? Clomiphene primarily helps women with ovulation issues to conceive and has important off-label uses for male fertility. Conditions Clomiphene treats: female infertility, primarily treats anovulation, absent/irregular ovulation, in women, especially those with PCOS. It can also be used for unexplained infertility. Approximately 70 to 85% of anovulatory women ovulate, and 40 to 50% achieve Clomiphene citrate pregnancy, mostly within 3 cycles. Male infertility, off-label, Clomiphene tablet uses for male fertility include treating low sperm count due to insufficient testosterone. It can increase testosterone levels, improve sperm count and motility, enhance erectile function, and reduce fatigue. Secondary uses: ovulation augmentation, can enhance ovarian activity to produce more than 1 egg per cycle in regularly ovulating women. Luteal phase defect, helps prepare the uterine lining for pregnancy by boosting progesterone. Menstrual cycle predictability, makes cycles more predictable, aiding timing for conception. Multiple pregnancies, Clomiphene increases the chance of multiple pregnancies, 5 to 10% of cases, mostly twins, due to stimulating multiple follicles. How does Clomiphene work? Clomiphene citrate mechanism of action involves influencing the brain's hormone centers to stimulate the release of hormones essential for egg development and release. It acts as a selective estrogen receptor modulator. Mechanism of action: Clomiphene mimics estrogen, promoting egg development and release, user's content. It works by modulating the hypothalamic pituitary gonadal (HPG) axis. Hormone interaction: as a selective estrogen receptor modulator, SERM, Clomiphene binds to estrogen receptors in the hypothalamus and pituitary gland, blocking negative feedback. This fools the brain into increasing follicle-stimulating hormone, FSH, and luteinizing hormone, LH. Nervous system action: female, increased FSH stimulates ovarian follicle growth, and LH triggers ovulation, often leading to 2 to 3 eggs per cycle. Male, increased LH stimulates testosterone production in late egg cells, and FSH aids spermatogenesis, improving sperm parameters and alleviating hypogonadism symptoms. Clomiphene dosage: Clomiphene is available in tablet form and is usually taken once a day for 5 days, starting on or around the 5th day of the menstrual cycle. The typical starting dose is 50 mg per day, but the dosage may be adjusted by your doctor based on your response to the treatment. What should I do if I miss a dose? If you forget to take a dose of Clomiphene, take it as soon as you remember. If it is almost time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for a missed one. What happens in case of an overdose? An overdose of Clomiphene can lead to symptoms such as nausea, vomiting, hot flashes, visual disturbances, and ovarian enlargement. If you suspect an overdose, seek immediate medical attention. What to avoid? Do not take more than the prescribed dose. Avoid alcohol while taking Clomiphene, as it can increase the risk of side effects. Be cautious when driving or operating machinery, as Clomiphene can cause visual disturbances. What are the side effects of Clomiphene? Understanding potential side effects helps patients make informed decisions about treatment and recognize when to seek medical attention. Most side effects are manageable and temporary, but some require immediate medical intervention. Some common side effects, such as flushing, feeling of warmth, stomach upset, vomiting, breast discomfort, headache, abnormal vaginal bleeding. Some side effects can be serious. Blurred vision, visual spots or flashes, double vision, stomach or lower stomach pain, stomach swelling, weight gain, shortness of breath. Consult a doctor. Immediately contact your doctor for any serious or worsening symptoms, especially vision changes, severe stomach pain, or shortness of breath. Precautions and warnings. Before taking clomiphene, it is vital to be aware of certain precautions and warnings, as it may not be suitable for everyone and requires careful medical oversight. Who should avoid? Contraindications. Pregnancy. Clomiphene citrate pregnancy is strictly contraindicated, Category X drug. A negative pregnancy test is required before each cycle. Liver disease, ovarian cysts, unless PCOS, abnormal uterine bleeding of unknown origin, pituitary tumor, uncontrolled thyroid/adrenal dysfunction, primary pituitary/ovarian failure, known hypersensitivity, menopause, and children. Conditions requiring caution. Endometriosis, uterine fibroids, history of blood clots, mental depression, hyperlipidemia/high triglycerides. Driving/operating machinery, due to vision changes. Breastfeeding, may reduce milk supply. Underweight/overweight, smoking/recreational drugs. Male-specific, testicular tumors, gynecomastia, increased prostate cancer risk. Age restrictions, not for children or postmenopausal women. Alcohol or food interactions. Alcohol, minimize or avoid, can worsen side effects and interfere with hormones. Grapefruit/grapefruit juice, avoid, can increase clomiphene levels and side effect risk. High-fat meals, may delay absorption, take on empty stomach or with light meal. Caffeine, limit intake. Possible interactions with other medications, drug interactions. Clomiphene may interact with various medications, supplements, and even certain foods, potentially altering its effectiveness or increasing the risk of side effects. Always inform your doctor about all products you are taking. Specific drug interactions. Increased clomiphene levels, drugs like abrocitinib, afatinib, amiodarone, clarithromycin, curcumin, cyclosporin. Decreased clomiphene levels, drugs like apalutamide. Clomiphene increases other drug levels, drugs like abemaciclib, apixaban, dabigatran etexalate. Contraindicated combinations, ospemifene, pharmacodynamic synergism. Caution needed, benazepril, increased hypotension risk. Male infertility combinations, sometimes used with HCG or anastrozole. Supplements and herbal products, inform your doctor about all supplements, e.g., curcumin can increase clomiphene levels. Food interactions, avoid grapefruit/grapefruit juice, increases clomiphene levels. High-fat meals may delay absorption. Limit caffeine. How should clomiphene be stored? Proper storage of clomiphene citrate tablets is essential to maintain their effectiveness and ensure safety. Recommended storage. Store in original, tightly closed container. Keep at room temperature, away from excessive heat and moisture, avoid bathrooms. For long-term sealed storage, 4 degrees Celsius is recommended, avoiding moisture. Improper storage effects, exposure to heat, air, or light can compromise chemical stability and reduce therapeutic effectiveness. Safety, always keep away from children, direct sunlight, and sources of ignition. Ensure container is tightly sealed in a cool, well-ventilated, moisture-free area.